Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I'm Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Join me on the first and third Thursdays on the Dr. Diane Show, where I have experts from around the country teaching you cutting-edge therapies on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. And you can like and subscribe to my channel, Dr. Diane Hayden. I'm excited today to have Dr. Kelly Livingston on with me. She is a naturopathic physician, speaker, industry leader in gut-brain health, and nervous system regulation expert. She is the creator of the Vital Spirit Method, which is her signature method to cultivate resilience through body, mind, and spirit medicine. She founded Roots Deep Medicine Clinic in Connecticut and has been providing naturopathic medicine to families since 2013. With 12 years in private practice and 20 years of experience in the health and wellness field, her clinical focus is helping women on the verge of perimenopause or menopause recover from chronic and traumatic stress so they can feel strong in their bodies, clear in their minds, and alive in their souls. So welcome, Dr. Kelly. How are you today?
Thank you. I'm doing well. Thanks. How are you?
I'm good. I'm good. I love that last part. Strong, clear, and alive.
Thank you.
Yeah.
Yeah.
So let's talk a little bit about why and you decided to become a naturopath, and then we'll get into, I know you have this whole method that you do and a podcast that you started and all that, but if we can back up and just let our listeners know, like,
Yeah.
what like prompted you to go do that?
For sure. Yeah. So I was a psychology major as an undergraduate. And right out of college, I was working at the New York State Psychiatric Institute. So I graduated with my psychology degree. But all throughout that process, I also studied basically the philosophy of healing. So I did a lot of research in bioethics and decision making and in healthcare and how decisions were made. And so I always kind of had a little bit of a holistic mindset around health and health philosophy. And so I was working at New York State Psychiatric Institute, and I realized I didn't really want to be in the research realm as far as going and getting my PhD. That's what I initially thought I had wanted to do. But really working in research, I saw getting my hands a little dirty, so to speak, and doing EKGs and blood draws. I saw, okay, this is a bit more of that intimate connection that I wanted with humans in the healing process. And so I said, okay, I want to go and actually go to medical school. So I started a post-baccalaureate pre-med program. And again, through that process, I was working with a surgeon as a medical assistant, applying to conventional medical school. And I still send patients to this surgeon. He was great, but this was probably back in 2008 or so. And I again just realized, okay, not exactly the type of medicine I want to practice. And the audiologist at that practice said to me, well, you keep talking about nutrition and psychology and counseling and have you ever heard of naturopathic medicine? And I had not. And so I looked up basically the philosophical tenets or the principles of naturopathic medicine. And I immediately knew that was what I was thinking of in my mind when I had this idea of what type of practitioner I wanted to be. And so very quickly from there, I reached out to the University of Bridgeport and I enrolled as fast as I could, get my transcript over and start the process. I just knew right away. That's what I wanted to do. So,
Yeah, that's really awesome. And I meet so many practitioners like yourself. Either they had some type of chronic like health issue or trauma or something like that that kind
mhm.
of drove them into changing their practice or even just deciding to do that, right out of school. Or in your case, like it was sort of like an intuitive thing, I think, and I kind of
Mhm.
I feel that way too. my training in exercise physiology was classical training. I mean, we learned very little about nutrition, which is so funny because it's like, really? I mean, you
Right?
can
It's the
exercise all day
basis.
long. Yeah, exactly. But if you don't
Mhm.
have your nutrition right, forget it. But I don't know. I just always had this intuitive, knowledge that the body can do amazing things. Like the body can heal
Yeah.
itself. It's just given the right tools and resources.
Hmm.
So from there, you have a
Exactly.
pretty unique approach to women's health, and it's something called the vital spirit method. So tell us about
Hmm.
that.
Yeah, so I founded Roots Deep Medicine Clinic in 2013 out of school. And throughout the years, I functioned as a general practice. And so I did family medicine. I saw all ages, all chief complaints, which is essentially just what the patient comes in talking about in that first visit. It's not that they're complaining. I mentioned this on my own podcast, but it's
Mhm.
how we chart that, right? And so I was seeing everything and everyone. And over the last most recent years, I had been working with some business coaches, really trying to figure out who it was I wanted to work with and what the message was that I wanted to put out there. And I started to realize essentially when I looked at the numbers and got really clear, just looking back at patient experiences, who was it that I was helping the most and who was I really excited about helping and who was really coming through my door more frequently. And so, yes, moms are kind of the gatekeepers to family health. So if they brought their kids in, then they ended up wanting to become patients, or maybe they came in originally for hormones or gut health. But I started to realize, okay, I am seeing women between the ages of 35 and 55. And typically there is some hormonal component, there is some stress component. And because naturopathic doctors are so trained in treating the whole person, but utilizing the gut as that kind of first foundational place that we start working, I was having this great success with, chronic gut and gut health conditions. And I started to put together the pieces of the puzzle around, okay, well, if I'm going to work a lot of women through a system essentially and a methodology so that it's not so confusing and we're not, wondering what labs are we running, what supplements are we taking, but we're really going to track over time what's working for the most women, it made sense to start in the gut. And so I started realizing, okay, I'm helping women with nervous system regulation and hormones and this midlife, perimenopausal, menopausal transition, but I'm doing it by starting in essentially one place with everyone. And so I started to write out what that method looked like. And I have so many journals over the years with the content of this and just getting really clear with what is helping, how do we do this, how do I map this out as a roadmap so that it doesn't feel so scary to women when they start the journey. And so that's kind of how the Vital Spirit method was born.
That's really fascinating. And so you mentioned the like gut health, and I feel like that topic is coming up so frequently. We just did an expert panel on brain health. Actually, I do these expert panels every month with some of my practitioners. We talk about different topics, and there were so many things that went back to gut health, and
Mm-hmm.
people were just finally learning that it plays such a role in so many things that it's
Yeah.
brilliant on your end, I think, to start there, because it's more than just, okay, yes, we know that nutrition is so important, and what we put in what we eat, what we put in our mouth is so important. It, lays the foundation for everything else. But what's really take that a step further. And now, how is the whole digestive process
Yeah. And
handling that?
and even further, I was essentially trying to articulate quite a lot into, one sentence as far as what do I do and how do I help women? And that's where I started really getting clear on the gut brain axis, right? Because that's the interface between obviously our gut and our brain, but you've got your vagus nerve and your nervous system. And when you're treating women holistically, all of those pieces of the puzzle essentially need to be put together and kind of looking at that whole person. The gut brain axis is such a great foundational starting point.
Yeah, for sure.
Yeah.
Was there something in your own, like, did you have like some sort of healing journey yourself that kind of led you
Yeah,
to that?
definitely. Through this process, and certainly in naturopathic medical school, we have, a whole session where we're really physician as healer. We're working on ourselves and kind of exploring the naturopathic healing modalities. So I've had a number of, I would say, moments in my health journey where naturopathic medicine was very helpful. And then I would also say that throughout my life have been kind of a seeker of wisdom and knowledge. And at a young age, I struggled with depression, what I would label as depression now. When I was 8, my brother was born missing actually half of his heart. He was missing his right ventricle, and his arteries and were transposed. And so that was obviously a traumatic event when I was young. And so I've done a lot of work on kind of looking back to how my mental health impacted my journey and kind of how I would prioritize my health or not. And so I do look at my journey through the lens of, okay, how was my nervous system regulated or dysregulated? What role maybe was diet or exercise playing at different parts of my life? So I relate that all to patient journeys as well. And that was an experience that has certainly unfolded throughout my life. I'm 42 now, so going through, perimenopausal transitions myself. So I reflect on, okay, how is this impacting my mental health, and what do I need to change? There certainly are things that weren't working for me anymore, right? So I've prioritized, I would say, my mental health throughout the journey, and then definitely had times in life where I struggled with some hormonal imbalances and some other, I would say probably I would categorize myself as someone who, if I hadn't tamed the autoimmune fire, given family history and some things that have come up on labs before, for me, that would probably be something I was dealing with now. But I definitely practice what I preach. And so, yeah, I learn from my own journey for sure.
So if someone wanted to come see you, and you mentioned your clinic, which is Roots Deep Medicine,
Mm-hmm.
and then you also have the Vital Spirit method.
Yeah.
How do people decide like which direction?
Yeah, so the Vital Spirit method is kind of newer in the sense that I wasn't always labeling how I worked with patients in that way. And as I said, I kind of figured out throughout the years that it helped patients to see visually kind of a roadmap for, okay, what are we working on? Why are we working on it? Now there's so much research backing, for example, gut-brain axis research into mental health. So it's easy for me to kind of show a patient, okay, we're going to start on the gut-brain axis. Well, what does that mean? We're going to recognize and remove inflammatory triggers. We're going to figure out how to make the foundation of what you're eating and how you're moving your body, so that it creates this kind of healing environment, right? Because in naturopathic medicine, we believe in the body's innate ability to heal. So it really made sense to me to start, again, kind of articulating that and calling it something. And the Vital Spirit method was born. And so when a woman comes to work with me and they're in midlife, perimenopause, or menopause, I present this Vital Spirit method to them as essentially the pillars that we work through over time in our journey together. Now, Roots Deep Medicine Clinic
I love that.
is.
And we're gonna find out more. We got to jump to
Okay.
a quick break, but we're gonna find out more about Roots Deep when you come back. You're listening to the Dr. Diane Show
Awesome.
with me, Dr. Diane Hayden. We are back on the Dr. Diane Show with me, Dr. Diane Hayden. But before we continue, I want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com, or either of my 2 publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Dr. Kelly Livingston at www.drkellylivingston.com. That's spelled DrKellyLivingston.com. So before we went to break, Dr. Kelly, you were talking a little bit about the difference between your clinic, Roots Deep Medicine, and the Vital Spirit method. And you were explaining, if I'm a potential patient, how do I know like which path to go on? So
Yeah.
the Vital Spirit method is really more, well, correct me if I get this wrong, more for someone who, like, you're going to start with the gut brain access and all of that, gut health sort of motivated, right?
Yep.
Okay.
So I would start any patient essentially in the same way. So Roots Deep Medicine Clinic is my natural family health clinic. So I do see kids there. I do see women there. And then I was essentially noticing over time that the majority of my patient population was perimenopausal and menopausal women. And so I started getting really clear in how can I articulate a journey to those women. So what's the starting point? What tests might we be running? What are some milestones that we might achieve in each pillar, and really mapping that out. So certainly if a child came in, with a GI symptom, I'm going to be starting with the gut brain axis with them as well. So it's essentially me articulating and showing patients what the journey of working with me looks like. And when we're working on women's health, we call it the vital spirit method.
Gotcha. Okay.
Yeah.
Okay. And I know I said you're located in Connecticut, but where is your practice in Connecticut?
Yeah. So I'm in Westport, Connecticut. I started my practice in Stamford, and then I was actually in Norwalk and Darien. I just kind of moved up the line a little bit. So I'm in Westport. I'm on the Saugatuck River. We have a beautiful view of the water, which I can see right now, but you guys can't.
Oh, awesome.
And so I really love having a little bit of that nature element right outside the window. Patients always walk in and they see the plants and the water, and it already has a kind of that nervous system regulation feel to it, which is what we're aiming for.
In fact, that picture behind you is calming me down.
Yeah. My sister gave me that. I've had this since my very first office in 2013. So yeah,
and
it's come with me.
Do you see people virtually too?
I do. Yeah, I always did see patients virtually. We establish patient care. Typically, they come into the office for that first visit. And then I always used an EMR platform for patients for my electronic medical records, and it had built-in video. And so a lot of patients have busy lives. And I always say to patients, I don't want our therapeutic relationship to be more stressful. So whatever is the easiest, if we're going over labs, I screen share with them on the video. So I've kind of always done that. And then during COVID, people got used to it. So yeah, that's part of the practice for sure.
Yeah, that's great. So anybody who's listening to this, no matter where they are in the country or worldwide even.
I actually have a lot of New York patients, which is interesting too. So which is kind of grown along the way.
So you mentioned something before that kind of stuck out to me, nervous system regulation, or maybe it's dysregulation if it's not functioning correctly. So how would someone know, I suppose, if it's not regulated or there's some dysfunction there? And then how do you work with patients for tell me what's maybe there's symptoms that we could talk about, or then what is sort of the method of how you get someone back on track with that?
All great questions. I have a few podcast episodes on this as well. So essentially, you can think about your nervous system, and your autonomic nervous system is really that automatic control. So I talk a lot about the vagus nerve, for example, where you're not really thinking about your heart rate. You're not really thinking about breathing throughout the day, right? You have this autonomic nervous system that's just kind of controlling your bodily functions. And then most people have heard about sympathetic nervous system. So that's your fight or flight. So that's when you're triggered or activated. So some signs maybe that you're in that sympathetic state might be your heart's beating a little faster, or you're shallow breathing in your chest. Maybe you're sweating. You might feel anxious. That's kind of that sign that you're activated. We think about that as like running from the bear or fighting the bear, right? And then most people have also heard of the counter to that, which is your parasympathetic rest and digest or calming nervous system. So some signs that you're able to get into that. And the vagus nerve is the nerve that actually kind of acts like the brakes and helps you get into that parasympathetic calming. Some signs that you're able to would be you sleep well, your digestion's great. So you can imagine signs that you need some, regulation or help with parasympathetic would be insomnia, not sleeping well, anxiety, sometimes constipation, or even, IBS can be related to nervous system regulation or vagal tone. So there can be a lot of different signs of that. And I would say that, as naturopathic physicians, again, we're trying to get the body into this healing state. I was finding, especially in the area of the country that I work, that there are a lot of, stressed out humans coming in, and they were definitely not easily getting into that healing state. And so the parasympathetic is when your body's healing. So if you're constantly in that triggered fight or flight, go, even positive stressors, right, can be activating, well, then you're not getting into that healing state. So with patients who maybe weren't improving, and I thought, well, we've done, RID protocols, we've worked on dysbiosis, we've detoxed, we've done all the things. What's holding this patient back? It was typically that their nervous system wasn't getting into that healing state. And those are some signs of it that I just mentioned.
Yeah. And how you know that, honestly, is you're not sleeping well, you have
Mm-hmm.
digestive issues. And some people, like know that they're stressed. Some people don't even know it, but a lot of people I think can feel that,
Right.
that they're under stress, not good stress, negative
Right.
stress.
And so with the vital spirit method or with any patient, when I'm starting from step one, I'm assessing, okay, what role is the gut brain axis playing here? Is this the nervous system? Is this more a gut health issue? Is this anxiety that's more thought based? So I'm really kind of trying to tease out what's going on a physical level and then what is more involved with the nervous system essentially. And then I move on to assess things like HPA axis function and stress response. So you can both use labs to assess what level of dysfunction, or dysregulation the nervous state might be in, but you can also do that with a really good intake, with observing that patient, with asking a history around chronic stress or traumatic stress. So there are a lot of ways where you can kind of gather information around what role the nervous system is playing for that patient. And that's really all part of the process throughout the vital spirit method. And then giving patients tools and kind of daily life habits, right, that can help them get into a more regulated state and kind of thinking through decisions around food, decisions around sleep and hydration. And in our practice, we call them the seeds of health. And how can each of those seeds of health, when you water them, contribute to a regulation or a parasympathetic healing state versus a dysregulated state? So most simple example, right, would be like hydration. So if you're dehydrated, that's not going to help you feel regulated in your nervous system. Very simple one, but a good one, I think.
Yeah, that or electrolyte deficiency,
For
possibly,
sure.
low blood sugar, or just a lot of
Mm-hmm.
fluctuations in blood sugar. What's
Absolutely.
interesting, I am hearing a lot of interesting enough just from people that I know, friends, both more so women, but men as well, is a lot of people dealing with, and probably in later, like menopause type time of life, but dealing with like arrhythmias or PVCs or things like
Mm-hmm.
that. And it's curious to me because I feel like, wow, I'm hearing like a lot of people talking about that now. I don't know if that's something you see or have seen coming into your practice, but
Yeah, and that certainly can be a sign of dehydration, right? Or some mineral imbalance, electrolyte imbalance. I run a lot of micronutrient panels on patients, and sometimes that will, uncover an imbalance or nutrient deficiency when we do that. Also, so midlife is a time where, for example, Hashimoto's can come out, other autoimmune conditions, or Hashimoto's is thyroiditis. So you might notice that there is a change in your thyroid, or maybe it's not picked up right on a lab, and that can contribute to some of those symptoms as well, or even hyperthyroidism. So just making sure that you're looking into a good blood workup, blood sugar, inflammation, all of that's exactly what I do with a new patient visit.
mhm. Yeah, all good. So you mentioned that you recently launched the Vital Spirit podcast. That's
Yeah.
awesome. Yeah, what inspired you to start that?
Oh my gosh. So I remember so I have an almost 10-year-old. And so throughout pregnancy and then when she was really young, I was home with her and, still growing my practice. And I would listen to so many podcasts. I'm a book reader, but I'm essentially just an information junkie. It's
Yep,
my
me
happy
too.
place is learning for sure. And so it was a combo of, I must admit, it's like a combo of true crime and like health detective work. So I would say like functional medicine, naturopathic medicine, and then, anything psychological and just, positive psychology, bettering yourself in any way. So it's kind of an odd mix of, true crime and that for me with the podcast. And so I started thinking, I have a lot that I want to say and put out there, but I would always say to friends who would ask me, like, why don't you write a book? Why don't you start a podcast? No, no, no. I want to be in practice for 10 years. And I don't know why. And I'm not against anyone that starts one right away out the gates, good for you. But I just had this number in my mind. I want to work with patients for 10 years and really get clear on what my message is. And then I knew I wanted to put it out into the world in some way, whether it was a book or a podcast or both. And so for a long time now, it's been kind of, I don't really have a vision board with podcasting on it, but it's been in my mental vision board. But if you're familiar with human design, like I'm a generator. So I've been generating this idea and kind of incubating it. And essentially, I want to have somewhere to send patients because I was sending patients to other people's podcasts all the time to learn things. And I, again, wanted it to be kind of organized in this way that it makes sense what we're going through. We're trying to learn a lot when we're working together in the beginning. And so if I had this roadmap and then podcast episodes that they can listen to, I felt like it would be helpful. So here I am.
No, I think it's brilliant, honestly, because I can't tell you how many practitioners have said, like, oh my gosh, I say the same thing over and over. Like, I need to have a book or whatever that I give them. So I think it's awesome.
Yeah, it for sure is a way to buy back time for me too. I do say the same thing a lot. And if I can say to a patient, listen to this episode, and then we're going to talk about it, and we're going to work through all the tools that I mentioned together one-on-one, it just, things go faster. It's more effective and efficient.
Yep. I love it. I love it. Well, we're going to take another quick break. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden, and I am talking today with Dr. Kelly Livingston. You can learn more about her at www.drkellylivingston.com. That's spelled DrKellyLivingston.com. And she also has another website for her clinic, which is rootsdeepmedicine.com. So welcome back, Dr. Kelly. We were just chatting a little bit about your podcast. I think it's, like I said, it's a great idea because people, your patients and even people who are maybe thinking about working with you now can go hear you talk about all these different topics, and they can start learning and kind of, prepare themselves for working with you.
Yeah, exactly. You chew off a lot when you are a holistic healer because it's mind, it's body, it's spirit. What does that even mean? So yeah, hopefully it helps people become familiar with my practice and myself. Yeah.
Yeah, for sure. So, and your work centers around that, a mind, body, spirit approach to healing.
Yeah.
And especially for women that are going through perimenopause or menopause. So I wanted to talk about just what you see as far as misconceptions about that transition, because I think there's a lot of them. Like, I've even heard my friends say, like, all of my friends most of them are in menopause, or at least like the beginning stages of it. And they all kind of have this attitude like, well, I'm going to gain weight, it's inevitable, or, this is going to happen, or that's going to happen, or I'm not going to feel great. Like they all have these ideas of what happens with aging. And here I am. I'm like, no, that doesn't happen.
Stop.
And it's like, I can't get it through their heads. Like, I don't know, like if that was just something, and granted, I do understand that it's different for everyone. Some people go through menopause very easily with not a lot of issues, and other people have the worst time. So it's not like we're saying, everybody's it should be this easy. Just take these steps. I totally get that. But I think that
everyone's journey is unique for sure.
We have to flip our mindset about it though, because everyone thinks like, oh, this is what's going to happen. Maybe something their mother told them or their grandmother told them, or just our society tells them. So what do you see are some of the biggest misconceptions?
Yeah, I get fired up about this on one of the newer episodes of the podcast. I'm kind of feeling out my listeners, like, how feisty can I get about this topic?
I love it.
But yes, I agree. I do find that we get hyper fixated and focused on the physical symptoms, and they do tend to have this negative narrative. And part of that episode was really around, okay, number one, it doesn't always have to be that way. There are a lot of things that can be done to prep your body for this. And number two, instead of being so focused on the physical, because again, there is a lot to do to alleviate those symptoms, right? So the journey doesn't have to be so negative. But then in addition to that, it is this initiation. It is, and we're not taught this. We're not, in women's circles anymore. Well, not a lot of women, some are, right? But learning
Yep.
from our elders about this being an initiation and like this being a rebirth or when you come back to yourself. And I know I haven't gone through actual menopause, which is really just one day, right? It's when you've gone a year without your period. It's that one day and then you're
Right.
postmenopausal. But I'm in the, starts of perimenopause. And this is really just from my experience watching women who many have taken this to be a positive transformation and to prioritize themselves and say, I'm going to get healthy right now. And I'm going to track my blood sugar. I'm going to do that exercise that I didn't prioritize before because I was taking care of all the kids. And like, it can actually be this positive transformation. And I'm going to, go deep into my soul work and figure out what it is that I want. And I've seen it be beautiful. And, women feel like it has to be this negative thing if they're accepting that programming and that story. And so I try to talk a lot about how no, it does not need to be. And I've seen it be a transformational time in a positive direction. It's also a time where I honestly feel like chronic and or traumatic stress has built up. And so if I have a woman come in and I create a safe environment for them and we look at their labs and we rule other things out and we have these honest conversations around the role that stress maybe has been playing, it is a time where women have these aha moments of, okay, this is something I really have to get serious about. Like my body is telling me this and I'm going to start listening. And so I think that that can be really beautiful. And the outcome is, longevity, it's better health outcomes later on down the line, less cardiovascular risk, better bone density, all the things that, we want to have happen as we go through menopause anyway. I also think there's a lot of misinformation in that women don't realize that some of the symptoms they're starting to experience, whether it be the sleep disruptions that are some of the first signs of progesterone dropping, for example, during that phase, or the brain fog or the irritability. Like sometimes they're told, oh, no, that's just getting old, or it's all in your head, or here's an antidepressant, or here's a birth control for your period changing. But the reality is, no, that's perimenopause. And there are other things that we can optimize or rule out or look at. And then there are things we can do to support your hormones during that transition. It doesn't even have to be these negative symptoms. So yeah, I could keep going.
Right.
I get very excited about it.
I'm sure you do. I'll tell you, it's funny. So I could not, this is, people are probably going to be like, oh, she's nuts. I could not wait to get to this time of life because I was sick of having a period every month. Like, I never wanted children for whatever reason. I don't know. I was more like, I was an only child, and I am an only child. And I grew up with like a lot of surrounded by a lot of old people, not like a lot of kids. So I'm very comfortable with like older people, seniors, and all that kind of thing. Not that I'm not comfortable with kids, but I just never kind of had that, I don't know, mothering instinct or whatever. I was like more going to be about a career. So I
Yeah.
saw absolutely like no need for menstruation at all. And I'm like, please, can I be done with this? I can't wait for menopause. People
Yeah.
would laugh. My friends would be like, you're crazy. Do you know what happens? But that was my mindset. Like, I was like, it's going to be great. And so have I had like hot flashes and things like that? And what changes? Of course, everybody does. But I think it's
Mhm.
been easier for me because of my mindset about it. Like, I'm going into this looking forward to here's the good side of it, right? Like, I'm not
Yeah.
focused on what all those negative things might be.
Yeah, exactly. I love that.
So hopefully some of our listeners can jump on that bandwagon. Yes, let's look forward to it. There are some positives.
Yeah, absolutely. I've seen them. And yeah, that was part of my motivation, for in doing the podcast is that I think more women need to hear that message and that there's a lot to do, right? And it doesn't have to be negative. And then even what's going on, right? Like what's going on with our hormones, with our body. And if we haven't paid attention before, now's the time to pay attention.
Yeah,
Yeah.
for sure, for sure. So I want to make sure we talk about, you have a free webinar
I do.
where people can learn the foundational steps to reclaiming energy, balancing their hormones, healing their gut.
Yeah.
People can find that at your website, right? drkellylivingston.com.
Yes. Yeah.
Okay. And what's like some of the takeaways? What will listeners walk away with if they go and
So
watch
I
that?
I do walk you through the vital spirit method and explain in more detail what each pillar is so that patients kind of know what they're getting into and what my approach is. And then I do talk about how there are so many answers beyond being handed a pill. And there's a time and a place. And then I think it's episode 1 and 2 of my podcast. I walk you through the therapeutic order. So we're not saying that there's not a time or a place when you might utilize a pill, but there are so many other options and foundational healing tools that you can be doing every single day. A lot of them are free. So I talk about that in the webinar too. Like there are things you can do at home that are really easy and will make a profound difference in your health. And I do, again, talk about the nervous system and really kind of walk you through what it looks like to go on the vital spirit method journey. And I kind of speak to some of the points that you might have in your mind around obstacles to that, right? So I think it's a good educational tool and a really nice way for you to start to get to know me and our approach at roots deep medicine and really what the vital spirit method is.
And when someone comes to work with you, and I know this, I'm generalizing a little bit because it's very individualized. I'm sure it depends
Yeah.
on, what the person's situation is. But typically, how long does a patient work with you for?
Yeah, it's a great question. And I usually say to patients in their discovery call, so if a patient wants to become a part of our clinic, then you typically will get on a discovery call with me. And what that means is I ask about what your health goals are, what your main concerns are. I explain to you, how Root Steep works, what the Vital Spirit method is, and begin to assess, what is the best role that I can play in that patient's healing journey. And so I always explain that the journey looks different, right? And so even if if you're in the New York City area, maybe we're all getting on 95 and we're going from New York City up to New Haven, but we might all start at a different exit. So some of us are starting, exit 0, and some of us maybe have been on this journey for a while and we're halfway up 95. We're also starting in different cars. Some of us are walking, some of us are biking, some of us are rollerblading, and just kind of getting clear and really acknowledging and accepting compassionately without judgment where we're at in that journey is kind of step 1. So having said that, typically a patient will come in and meet with me. We spend about an hour together in that first visit. And after that first visit, about 3 to 4 weeks later, we have a follow-up visit where we're going over labs. So most patients are doing at least 2 visits with me that are about a month apart. And then we have what we call your health journey visits. And so you have 3 visits that we really kind of discuss all of the pillars that we're working through. Maybe we're going over some more functional labs. We're talking about diet, lifestyle changes. We're watering those seeds of health. So that really looks different for everyone, right? And after those health journey visits, then you're kind of grandfathered into the system of Roots Deep Medicine follow-up care. So I would say most patients probably average 4 or 5 visits to establish care, and then they're checking in. So of course, if we've done all this wonderful work on your gut-brain axis and maybe you get a sore throat and you want to follow up and say, okay, I don't want to go on an antibiotic. I don't feel like I need it for this infection. Can you guide me in that way? You've probably learned some things that you're going to do naturally for your immune system at home. And then again, I can guide you in those moments of acute need. So that's kind of a mixture of Roots Deep and Vital Spirit method, what the average patient goes through or works through with me.
Yeah, and obviously everybody's different. It's all individualized. And I think,
Yeah.
I tell people you didn't, for people who have some type of chronic health issue, it didn't happen overnight. So
Yeah.
you're not going to fix it overnight. Like
Right.
it's kind of
When
that
we're working on
unraveling.
an autoimmune disease, right, where you have much longer relationships than just figuring out an easy constipation or SIBO bloating case. Not that it feels easy to them, right? It's the
Right. Sure.
unique patient journey. And I love patients that I've had, since the beginning of my practice. We have such a special relationship. They've grown with me and I've grown with them. And yeah, they're some of my favorite patients to see on the calendar for sure.
That is awesome. That's awesome. We're going to take another quick break. When you come back,
Okay.
we'll be talking with Dr. Kelly, and I'm the Dr. Diane Show. We'll be right back. back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. And I'm talking today with Dr. Kelly Livingston. She's a naturopathic physician and founder of the Vital Spirit Method. And you can learn more about her at www.drkellylivingston.com. That's spelled DrKellylIvingston.com. So, one of the things I wanted to talk about during this last segment with you is you talk a lot about how we can reclaim our health by returning to the body's innate wisdom. Mm-hmm. So just explain a little bit about like what does that mean to you? How does it show up in your work?
Yeah. So again, a lot of my work is really founded in, true naturopathic medicine and the naturopathic principles and the therapeutic order. And so I've seen time and time again now clinically that the body has this innate wisdom. It has this innate ability to heal, right? And we have to give it the tools and we have to remove obstacles to cure, we call them. However, I think of that also a little bit separately, although I think it's the same innate wisdom that you're kind of tapping into and listening for or communicating with, that gut instinct. It's a little bit different because when patients are dysregulated, for example, and they're not getting into that healing state, it's a lot harder for them to hear, hits from the nervous system of a gut instinct, a yes or a no to a situation. It's, if a patient is struggling with IBS or bloating or diarrhea, right, they're not necessarily knowing like, oh, that gut instinct was, I should be saying yes to that situation or no. It's that really true innate inner knowing. And so I find that as we clear physical root causes, and that might be something like a thyroid issue or anemia, or working on removing food allergies that were triggering IBS, it's a lot easier for patients to get into that calming rest and digest state that is really the foundation for kind of tapping into that innate inner wisdom and inner knowing. So I'm giving simple examples of a gut instinct because I think most people can kind of understand what that feels like, but that's essentially that innate healing power that we're trying to stimulate and turn on as naturopathic physicians.
That's so interesting because I bet, like, as you were just saying that, I'm like, I never really thought about the connection between, having either nervous system dysregulation or a gut issue, let's say, and my intuitive ability, I guess, like you're saying, like that gut instinct. And it's funny because if I look back at times in my life where I was struggling with a decision and I really just like I really just don't know which way to go with this. I would have to think about it. I'm going to think about it for sure. Like, was I struggling with insomnia then? Or was I having some gut issues or something? Because I don't think I've ever put two and two together like that. And it's like, duh. Yeah.
Yeah. And it's funny. I forget what episode, I think maybe episode 6, I talk about this because I'm talking about the vagus nerve, but my dad had a stroke about 4 or 5 years ago. And I was going down the rabbit hole of like nervous system healing and nervous system regulation and like anatomy, where his stroke was, like so many different things. Right. And I was working with a few patients who just weren't improving with their gut health in ways that I would have expected. And that's when I got certified in the Safe and Sound protocol and heart math for trauma. And I was really diving into polyvagal theory and understanding nervous system states. And the chronic GI patients were the ones that I started really putting it together. Like, well, duh, they're not getting into a healing state. That's like naturopathic medicine 101. But sometimes we get distracted by like changing diet and all the things. And it sometimes is just this foundational piece. Well, that person is chronically dysregulated. And when you remove that obstacle, they didn't even, maybe need the restricted diet or, obviously sometimes we use therapeutic diets, but it's a great example of the role the nervous system plays.
Yeah. And likewise for people who are, struggling with that or feeling burned out or disconnected with their health, maybe during midlife, or I think it could be like any point in their life. Like, what's the first step that you recommend for people to take?
I think the best step is really even just understanding that the nervous system plays a role. And so, even if you Google the polyvagal ladder or polyvagal theory, I have some posts on Instagram about this too, but just knowing what nervous system state you're in. So, that's, the one of the first things I do in my group program modules or in the Vital Spirit method when I'm walking patients through, officially is recognizing what nervous system state they're in. Because to your point, there's also, we talked about that sympathetic fight or flight, right? There's also ventral vagal, which is socially engaged and safe. That's kind of like where you all want to live. Everyone wants to live and feel safe and joy and compassion and all of that. But then there's also dorsal vagal shutdown. So some patients, remember when I'm talking about kind of teasing out, is this a nervous system? Is this gut brain? Is this physical root cause? Is this mind body? One of the things that I'm assessing is, okay, or is this patient's burnout, depression, hopelessness that they're in a dorsal vagal shutdown? So I know that's all a lot of words, but if you just look up the polyvagal ladder and you look, am I in ventral vagal? Am I in fight or flight? Am I activated? Am I not? And start thinking about on a daily basis and then throughout your life, where does your nervous system tend to live? Do you get activated? Do you go anger? Do you get dorsal? Do you go shutdown? And just start paying attention. Like, you don't even need to do anything about it yet. That acknowledgement and understanding, I think, is a very profound first step for people.
So it's called the polyvagal ladder.
Polyvagal ladder. Yep.
Yep.
Or just even look at, you can put what state is my nervous system in. A therapist who's by the name of Deb Dana, which is really easy, DEBDANA. She has some wonderful resources on this, workbooks. There's a lot that you can just kind of dive in now that the internet's great for that, right? That's not going to overwhelm you. Just start to say, what state is my nervous system in? Where do I tend to go?
Yeah. And is it like a questionnaire or is it like
no, it's just an image. It's just a diagram. And most people, when you look at it, you're going to be able to say to yourself, oh yeah, that's where I go. Right. Or, that's where my husband or my wife or my kid goes. Right.
Yeah.
You'll start to notice like we have patterns and it's not that you're ever going to always be in, the state we want to be in. It's about having flexibility and adaptability to move through. Like that's true resilience. And to, kind of wrap it up in a nice little bow, when women are going through midlife, if they've been dysregulated chronically, so say high cortisol, or maybe they are in that, that dorsal vagal, shutdown state, a lot of times things that we think are going to be fixed by taking a hormone, which again, there's a time and a place, it's more a nervous system dysregulation state, or it's the nervous system that's impacting the bowels. So we're not pooping. So we're reabsorbing our estrogen. And then we have these hormonal symptoms. So if you start with the nervous system and you start with the gut brain axis, which is the foundation of health, and you kind of work out from there, sometimes it's not even a hormone issue at all. Or if it is, you can start working on it that way.
That's got to be the one takeaway from the show. I swear, no, because like so many people think they have to go on hormones, like they have all these symptoms and they're like, oh, it's menopause. I need to go on bioidentical hormones or whatever they're going to do. Like I have friends on estrogen patch and all that.
Which I will advise on using. Yes. But there's so many foundational pieces, that your HPA axis and your stress response in particular impacts pregnenolone, which is your prohormone. It's your kind of mother hormone precursor to all your other sex hormones. So that direct, physiological link right there is enough for every woman to start to pay attention to their nervous system as a foundational piece of the puzzle.
Yeah, for sure. For sure. And there might be things that you would recommend they do that, they don't even need hormones.
Absolutely. Yeah. Like just having a nervous system regulating practice. I have a vagal tone guide, for example, that I give away for free on the website. And then on Instagram, it sometimes is very gentle, basic things. Putting your legs up the wall, for example, is one of the most basic yoga poses you can do to kind of start to regulate your nervous system. I've got, lots of easy exercises that you can do at home. You take a few minutes to yourself to do it to start, and you will notice a difference in in how we call it it improving your window of tolerance or your threshold. So the more you activate that parasympathetic calming rest and digest, you're going to be less likely to get triggered into one of those states that you're kind of prone to go into. So it's going to happen less. And then if you are triggered into a state and you want to have that flexibility to get back to the state that feels more comfortable, then you have that kind of muscle memory, essentially, if you've practiced something. Breath work, for example, is one of the most basics as well.
Yeah, which is so important. Yeah, for sure. So the one that you talked about, basically you're just lying on the floor with like your butt up to a wall with your legs straight up on the wall. Okay.
Yep. And just lay there. And the first minute you'll notice, especially if you do work on a computer, you'll just notice that your body is starting to relax and fall into the floor and just breathe. You don't need to do, anything else other than that, and just start to feel more regulated. So that's so simple. Anyone can do it. So, yeah.
Yeah, for sure. And the other exercises, was that something people can find on your website or?
Yeah, I post about these things sometimes on Instagram. I don't know that I have videos of exercises on the website, but that's a really good idea. I probably should do that. People would find that helpful, but I do have quite a few on Instagram. Throughout the last couple of years, I finally got committed to having a presence there. Again, just because I feel like there's not all this information out there for women, and they're often sitting there in their 40s, late 30s, early 40s, late 40s, early 50s, wondering, is it my hormones? Is it all in my head? Am I depressed? What's happening? And I just wanted to be, a beacon of some knowledge.
Oh my God. You have absolutely been that, like a huge beacon for sure. So I love what you're doing. I think there's been like a lot of amazing takeaways today, like a lot of things we talked about that I didn't know about. So I'm guessing a lot of our listeners didn't either. So thank you for all of that for sure. And
you're welcome.
People can find you at www.drkellylivingston.com or rootsdeepmedicine.com. And then also they can find your podcast, the Vital Spirit Podcast. So I hope a lot of people will be jumping over there and listening in on that for sure. And again, I want to thank you so much for all the great information.
You are so welcome. Thank you for having me.
Of course, of course. And I want to thank all of you for tuning into the Dr. Diane Show. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific, where I have experts from around the country teaching you cutting-edge therapies on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. Please like and subscribe to my channel, Dr. Diane Hayden. See you back here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.